Kia ora koutou. I'm Professor Christine Woods and I work at the University of Auckland Business School as the Teresa Gatting Chair for Women in Entrepreneurship. And I'm also the Director of the Aotearoa Centre for Enterprise and Women. Our focus and our purpose is to unlock the entrepreneurial potential of girls and women in Aotearoa, New Zealand. And we aim to do this through research and education and engaging with successful entrepreneurs, which that is what this conversation is all about. So how did I get here? Well, I'm Kiwi born and bred, but my interest in entrepreneurship first began when I worked in Malawi as a small business advisor. So I kind of joke that instead of catching malaria, and I know that's not a great joke, but that I kind of caught entrepreneurship instead and really became hooked on the passion and energy that entrepreneurs bring to what they do. So that's by way of an introduction to our wonderful guest today. So I'm really delighted to welcome Dr Anushri Anandaraja. Anu, thank you so much for joining us from New York. So Anu is an alumni from our med school here at the University of Auckland. She completed her med degree there and then has worked in a variety of different contexts, including non-governmental organisations, focusing on child health and disaster relief before coming to New York. And that's, I think, where you are at the moment, where she's trained in paediatrics, global health and public health at Mount Sinai Medical Centre. So educator, paediatrician, public health practitioner, social entrepreneur, and the founder of Women Together. And that's a social enterprise, non-profit organisation supporting international learning and women's grassroots groups. So welcome, thank you so much. And maybe to get started, I'd really like to hear a little bit more about your childhood growing up in Aotearoa, your early years and how you ended up in New York.
Yeah, definitely. And I apologize in advance. There are sirens. It's New York City. There's nowhere you can go that you can't hear these. So it's just going to be part of our soundtrack. So yeah, I grew up in, my heritage is Sri Lankan. My parents moved to New Zealand in the 70s before I was born. And so I was born in Hawera in Taranaki and then moved to New Plymouth and grew up, in New Plymouth, went to New Plymouth Girls High School. And really, Africa was the furthest thing that I could, that I would be exposed to growing up, basically on a farm in Taranaki. But from my earliest days, I had this passion, this interest in Africa that I couldn't explain. Mm-hmm. And so I was going to the library down the street and borrowing books about Africa and African animals, and I was obsessed with maps of Africa, and my whole room was decorated with, whatever I could find of African scenery and paraphernalia. And I just had this vision that that's where I wanted to be. I think part of it was Our World on Sunday night, seeing the amazing wildlife that was, in Africa and being really in love with that. And so I just had this vision that I was going to get myself to Africa. And my parents being doctors, they convinced me that the best way to get to Africa was to be a doctor. Since learned that that's not necessarily true.
No, but it's not true.
But followed that course and ended up in medical school at the University of Auckland, but also always with the vision that I was going to be working in a resource poor setting, and really saw myself as being able to build out health in those kind of settings. And so, from my earliest times at the medical school, really threw myself into the kind of activities that could take myself closer to that. And at the end of my third year, when we had some elective time in medical school, volunteered actually in India for a rural mobile hospital and eye surgery camp in rural India. And that's when I really found, what I was looking for, being able to practice in a rural setting, in low income settings, and really apply everything there was around being a doctor, but also public health to that kind of situation. And so then that became my passion from then on. I came back to, New Zealand. I did many other trips where I could engage in that kind of medicine and global health. Eventually graduated medical school, started my pediatric training, and then came to New York actually for my pediatric training and completed my pediatric residency at Mount Sinai here in New York City. And, you know, also during that time took every opportunity I could to do internships or electives or rotations in other places. And because I had started with that passion and that background from so early, my mentors were willing to be like, okay, so she's serious about this, and give me the time to do those things instead of kind of brushing it off. And so in 2004, when the Indian Ocean tsunami happened and Sri Lanka was really badly affected by that, I managed to convince my residency program to give me time off to go to Sri Lanka and set up pediatric clinics there. And so every experience I had kind of built my interest in and my expertise and my passion for this kind of healthcare and this kind of attention. And so when I graduated from my pediatric residency, luckily my medical school, the Mount Sinai School of Medicine, was ready to start a global health program and recruited me as one of the initial young faculty members to build that up. And so I spent about 8 years building up this program in global health. And that eventually, as we built up partnerships to allow medical students and doctors to have those same kind of experiences that I had had, as we built those up, we formed some relationships in East Africa. And so finally, after this long arc, my dream of being, you know, practicing as a physician in Africa actually came true. And I found myself working with NGOs and academic centers in Tanzania and Uganda and Mozambique, and then finally Malawi, to set up health programs that our doctors and medical students could also engage in.
So the program that you've got in Malawi, that's Women Together Global, right? So yes. A little bit more maybe about that and what are some of the things that you're doing with women in Malawi around that?
Yeah. So actually, after about 8 years in academic medicine, so doing global health, like trying to practice and be a global health physician through an academic center, I'd kind of seen the gamut of what went well with our traditional models of international aid and global health and what was going very poorly. And unfortunately, the amount that was going very poorly was an unacceptable amount of wastage of funds, human resources, a very colonial attitude that we had towards how we were working with international populations. And especially I saw, because, you know, my field was pediatrics, I was working a lot in maternal child health. I just saw how no matter how much we worked with women and children towards better health, we weren't leaving women in communities with any kind of transformation of their social standing in that community or their economic standing. So although we might have brought in malaria bed nets, we might have brought in plumpy nut nutritional supplements, we might have brought in clean water, all those things were great. But in the end, women were still living in poverty and still had no social capital and no social status with which to actually elevate themselves into a sustainable and economically and socially sustainable position. And so in 2016, I left Mount Sinai and started Women Together because I specifically wanted to look at what happened when we brought women together and really capitalized on, honored, and valued their knowledge and made them the ground zero of where we were doing our work. And so I had formed relationships in Malawi. You know, I'd been working there to do nutritional evaluations and so on. And so using those contacts, I set up Women Together in Malawi, but, you know, would like to spread beyond that. And what we did is we went into communities and spoke to women as the first thing we did. So instead of this model of receiving funds for research or receiving some donor-driven funds with a specific idea of what we wanted to do, say malaria, and then finding the community that was willing to take us on and do a malaria project with us, we instead started by going into the community, finding the women there, sitting down and really listening to them, asking, you know, what are the major barriers to your health and well-being in this community? What are you doing that brings you joy, that brings you money, and that you would want to teach other women how to do? And what do you want to learn? And with those three questions, we would get to know a community, would get to know what their capacity was, what their assets were, and what they needed. And then we would do a matching process where we would put pull groups of women together to exchange knowledge and skills. This group knows how to make soap. That group knows how to sew. That group knows how to make clean burning cook stoves. And so we would then, through Women Together, support learning exchanges where they could come together, exchange those skills, and build them into cooperative businesses.
So really working as a facilitator, I guess, for things that are then going to emerge, as you know, we were saying, from a grassroots point of view.
Yes. And what we found is that, you know, when we spoke to the women about their, you know, the major barriers to them being able to get ahead, you know, some of it came down to purely money, but a lot of it had to do with their day-to-day living. So one of the first communities we sat down with, we said, what is, you know, a major barrier to you being able to progress in your lives? And they said, firewood. We spend 40 hours a week looking for firewood. Our daughters aren't going to school because we can't get firewood, and they have to spend days looking for it. And their solution that they had actually heard of was cook stoves. And so we managed to facilitate them to be able to learn how to produce those cook stoves and distribute them throughout their community. And so, you know, they made a lot of money from this business, but it also solved this basic lifestyle issue that was preventing them from being able to progress in the way they wanted to.
So for you, you know, coming in what we would describe as a social entrepreneur, you know, seeing an opportunity, looking to create value and make a difference. So what have been some of the challenges that you've faced in this journey, kind of moving from, you know, whether you view it as the academy or within the institution of the medical profession? What have been the challenges that you've faced and or the barriers along this journey?
I mean, I'd say one of the big ones is that, you know, a lot of the funding that's out there for women's empowerment is channeled through old funding structures. A lot of the funding that is out there for just about anything in the world is channeled through very old patriarchal white supremacist structures. And what that means is that if women aren't at the table, the way those funds are designed, what they're designed for, and how they're distributed does not meet women's needs. And so what we've found is that we've had to step outside of a traditional funding structure and really form a network of women who are ready to support women. Because, you know, the old funding structure is there's a specific thing that a grant or a funder wants to fund. And then you, as the recipient of those funds, have to have a 1-year, 3-year, 5-year strategy and set metrics that you're going to meet. And what we know from the real world is that if we don't listen to the women about what their real needs are, that any project we bring will have a very limited impact. And also we have to follow the women from week to week, month to month, day to day, year to year, to be able to put the funds in the best place to leverage them forward. And so we can't always meet a 1, 3, or 5-year strategy. We can't always meet the metrics that are predetermined because we're listening and we're taking each step listening. And so it's a whole change in a paradigm of how to support, which is here are the funds and let's listen and apply them where needed. And that's just not a structure or a system or process that exists in traditional funding channels.
So you talk about impact, and that's one of the key things, you know, what's happening with regard to social impact, as opposed to a very traditional KPI measure of success, key performance indicators leading to success. So for you, working in this social enterprise and leading this social enterprise, how do you measure success in a holistic way, in a social impact way?
Yeah, I mean, that was one of our big fears when we started, which was like, this is an experiment. How is this going to work and how are we going to prove impact? And what we really found is that, you know, the social impact of it, like the qualitative data that we could gather pointed towards women's empowerment being achieved. Because as women engaged with each other, learned skills, saw each other as teachers and leaders, started their own businesses, then their self-confidence, their autonomy, their decision-making, on all of those measures, they improved. You know, they were now confident enough to lead their families. They started saying, you know, contrary to the past, that they would send their girl children to school because they could start to see the value of women and the future that was possible for women. So in all those measures, from our focus groups and our interviews, we could see that those were moving. And very quickly behind those, the economic impact followed very quickly. Because these women are smart and generous and strong and capable and ingenious. So it was just having the confidence, the autonomy, and then us being able to just leverage a little bit of funding where it was needed, a little bit of mobility, like actually just mobility of being able to get in a van and go to market, the connectivity, the digital connectivity, leveraging those in made it possible for the economic indicators, their economic well-being to take off. And so, we knew we could achieve the soft outcomes or the soft impacts that we wanted, but we've been very pleasantly surprised that the economic has come right behind it, because it's survival for those women. They're not going to be happy with, oh, I feel better about myself.
Yeah.
They really are, well, how is this going to translate into my kids being healthy and well and going to school, and my house being beautiful and my family going forward.
So you've got this integration, if we're thinking about sustainable development goals, there's so many of these that are coming together in the impact that you're having. So am I understanding that they're mostly Malawian women working with Malawian women as opposed to a number of expats coming in, or is there kind of a bit of a mix?
So we've really tried to keep it very slim. One of the things at the level of expats and external folks being, having any decision-making role on the ground. We love, Women Together is global. It's Women Together Global. So women come with us from the States and New Zealand and Australia and so on to Malawi to learn and to be part of that network. But we try very hard not to have the traditional hierarchy of giver and beneficiary and, educator and those being educated. What we really try to aim for is a very flat structure of we as women support each other. Some of us bring money to that, some of us bring expertise, some of us bring all of the energy and the time and the local intelligence, but us all working, pretty much together on that. And one of the things that I saw when I was in the field doing academic global health is that myself and my team from the States as foreigners had all this mobility and this privilege of moving in a certain stratosphere where we could fly and learn something from one group of women, fly into another country, transfer what we've learned from this group of women to this group of women. But there was no equity and no justice in that. We were basically an extractive industry. We were pulling that knowledge out, transferring it through a level of privilege and putting it down somewhere else. This group of women who were the holders and bearers and originators of that knowledge never got to teach this group of women. This group of women received that knowledge as if it was coming from expat, educated, white, mostly wealthy folks, instead of women who look just like them and live just like them. And so we've really tried to cut out that layer from what we're doing Women Together. So, I help to organize and facilitate the women meeting, but all the knowledge transfer happens on this level. And we have in-country coordinators who work with us, but they're also local Malawian women.
So whereabouts are you, working at the moment? In Malawi, are there other geographical areas, other communities that you're working with?
So we're mostly in Malawi. Right before COVID, we did start to do an exchange with Mozambique because ultimately we'd like to do regional and then international. COVID kind of put a damper on that for a minute, but we hope to move back into more of an international and global exchange. Recently, we've been talking with women's groups in Mexico and women's groups in New Mexico here in the United States. And we find that a lot of the issues we're dealing with are the same. A lot of it's around climate and environmental change, around arid land agriculture, clean cooking, water preservation. So those are themes that wherever we go in the world seem to be things that women are at the top of women's minds because they're dealing with the natural environment every day. They're cooking, they're gathering water, they're gathering firewood. So the changes matter to them. Then there are social issues like gender-based violence, female education and women's health that, again, all of these groups have the same concerns about how are they going to address these issues. And so ultimately, we would like to do global exchanges. Right now, we're working in individual places, but ultimately, I would love women who are working on arid land agriculture to come together with Indigenous women from New Mexico and women from Mexico to discuss these kind of issues and share that knowledge.
No, I mean, that kind of vision for where you're heading really pulls together so much, both your interest, your expertise, the passion, but also the experiences, the successful experiences that are emerging at the moment. So if you were to go back and talk to that young girl in her bedroom back in, Hawara, what are the things that you would say to her around what you've learnt, and what kind of pieces of advice would you give to her?
Such a great question. I think I would say to her, first and foremost, trust yourself. Really trust what you want to do and go towards it. And don't let people convince you that your vision or your goal for your life should be different from that. I think that's the strongest thing I would say. And that pertains to, don't let anyone throw you off track for what you dream you want to be in the long term, but also day to day. When you feel something, when you hear something, when you have a sense of how something should go, don't second guess yourself. That's probably something that you want to follow, or at least keep at the core of your consideration for how to step forward.
Yeah, I can remember an entrepreneur talking about a fingertip feel for things. And when you've got that fingertip feel, that kind of like an intuition or a feeling to follow that and to really see where that goes. And as you said, to back yourself in that. So on your entrepreneurial journey, you've got the kind of the med school journey, and then you've got this entrepreneurial journey that you've gone on and really embraced over the last few years. So as an entrepreneur, what kind of advice would you offer to other young women thinking about becoming entrepreneurs, whether they be in Malawi, whether they're in Aotearoa, New Zealand, whether they're in India? What would be some of the pieces of advice you would give?
Yeah, I mean, first of all, I would say don't be afraid of doing it. I know that, coming from a traditional background of medicine and working with an academic institution or a healthcare system, you become very complacent or very secure in having a well-defined role and a salary, and someone's taking here in the States, someone's taking care of your health insurance and your disability benefits. There's a whole structure that surrounds you when you're an employee that makes you feel very safe. And you can become very scared of stepping outside of that. And what I would say is take the risk and do it, because there's nothing like being your own boss. There's nothing like being able to create and design and put forward ideas that are your own and see them like succeed or fail, but ultimately feel like you're actually putting your full potential into something. Like that, I would not want to die feeling like I had not lived my full potential, and that takes risk. And I'm not saying it's easy, but the fear that's put into us about stepping out of a supportive structure and a traditional structure is unwarranted. Sure, it takes a lot to figure out how to start your own business and all of the admin and the structures. And here in the United States, to step out of a job means now you find your own health insurance. And there's a whole other very kind of like fatalistic viewpoint of those who step outside, this paternalistic structure that we're kind of ferried into. And I would just say, do it. It's worth it. It's not going to be easy, but neither is working inside a system. And then the second thing I would say is like, find your community. Like really stepping out on your own is really tough, but you don't have to be on your own. There are communities, there are networks, there are groups that you can join, that you can become part of, where support is available. And I have just loved being out and finding new groups of women to become part of and learn from, whether it's like the Auckland University alumni group here in New York, or just the New York expat community in New York, or groups of women who are working on different projects. There's so much vitality and strength and support available. So don't go it alone. Find your people, and be willing to share and exchange ideas and receive that kind of support.
So following up on that idea of find your people, find your community, who have been the mentors that have worked, that have, you've worked alongside, and who have been those allies, maybe men as allies coming in to support the mahi, support the work that you're doing?
It's been one of the things that's been difficult is finding really strong mentors. But what I have found is that instead of feeling like I have mentors, I feel more like I have a family of like-minded women around me as peers. And then I meet people like you and you become role models for me, right? And even though there might not be a really active mentoring, like I watch and I listen and I see how different people are doing things. And that contact and that watching people is really important to me. And the people who've become my kind of kinfolk have been fellow women entrepreneurs who are all struggling in their own ways, but we're all kind of learning and have little gems to share with each other. And so it's been a much more kind of osmotic way than having a mentor that I'll call up with a problem or, ask for advice for.
Well, I think too, you're doing something that is quite different, and so if you think about the established kind of aid development industry, for want of a better word, finding people that are breaking out of that or looking at it in a different way, I imagine there's not that many people, that are operating in the way you are.
Yeah.
So if you, coming back to those learnings, what do you think are the 2 or 3 really important things that you've learnt? I appreciate you talked about trusting your own confidence and trusting your ability, but is there anything else that sits in, look, that was just a key learning, or a key, there's one entrepreneur I know that has said there's only winning and learning. And I think a lot of us engage in a lot of learning. So it's been anything in particular that stands out for you?
And these are kind of maybe a little esoteric, but
hey, I'm
not.
I love esoteric.
One is patience, because I'm very quick, as a doctor, you're trained in problem solving. So I want to diagnose a problem and then fix it. And I found that often I mess things up by leaping in there too quickly to resolve something. One stream of funding falls away, I rush in there to try and rescue it. But, if I just waited and saved that energy, another funding stream comes up here that is actually much better suited to me. And I wasted a whole lot of energy trying to salvage something that wasn't right. Or the timing is off on a trip I want to make, or a group that I want to take somewhere, or a course I want to teach. The timing is off, and I will fight to try and bring it back on track instead of just taking a step back and waiting and trying to see, well, what is the environment actually doing? How is this moving? And, how would I align myself with how things are moving rather than battle to have things happen the way that I wanted them to happen? And so, the key for that for me is like sitting back and waiting and being patient and trusting in how something's moving. So that's a major thing. The other thing is like, as soon as you can get some amount of help, like we often start with 0 budget and we ourselves are working free, and the thought of bringing on staff is very, like, that's never going to happen, or it's so far in the future. And what I would say is, like, if you can get someone on board for your admin or your finances or your accounting, the things that you don't like doing, like if you're the creative or the designer or the intuitive, like you need some space for that process. If you're all tied up in doing your accounting and your taxes and your admin, your business won't move forward. Like your mission won't move forward because you're not giving what you need to give to it. So as soon as you can, even if it's 5 hours a week, start paying somebody to like have your person that you can put the admin stuff on their plate, put the accounting on their plate, put the expense, like, so that you have the space to actually bring what you bring, which is being the visionary of your organization. And don't get yourself stressed out, bogged down, give yourself an ulcer doing the stuff that you're not good at. Like, it's worth the money, small amount of money, to get that And then you'll feel your organization is sound too. It is being taken care of. You don't have to worry about the business aspect, because often that scares us. Like if we're not brought up as business people, I was brought up as a doctor. That aspect, I'm constantly neurotic about, is it being handled well? What if I get ordered? If I just have someone else taking care of it, that's something I wish I had done like 5 years ago now.
And those people coming in to do those particular roles, they love doing that. And they are really good at that. And then that builds into supporting, you know, the purpose, the mission, as you said. Final question. What would you say at this point is the biggest highlight or the biggest achievement? You know, what is it that you go, yeah, that's pretty cool? I sometimes think with these questions, if I ask myself, but really interested to know.
Yeah, I mean, every time I sit down with a Women Together group, like a group that Women Together supports, and I listen to them, it's the highlight of my life, because it's just like, this is it. This is what I dreamt would happen. Like Women Together. This is Women Together, and it never fails to disappoint. I mean, it never disappoints. It never fails to inspire and uplift and bring excitement. Like if I walk into a classroom that's being supported by Women Together and the girls are just like so, you know, excited about their lives and what they can do, or I get so many highlights in a year. It's just it's seeing that outcome.
Look, and I think, you know, one of the things that's resonated in this conversation for me, and in talking with you at other times, is that you had, it's one of the best examples I can think of as somebody that had a dream, you know, a kind of a fingertip dream, then gets the knowledge and the experience and combines those so beautifully for the mission and the purpose. You know, there's a proverb, a person's gift makes room for them. And it seems as though you have these amazing gifts that make room for the work that you and the vision that you have. So thank you so much for sharing your time. Look forward to many more conversations with you. Kia pai te rā. Have a good day. Thank you.
Thank you so much.